Hey there, welcome to VMC. I'm Dr. M. Today we're going to tackle an eye-opening topic. We are going to cover tear staining. Buckle up to learn about the common causes and treatments. Join me, you'll learn something today. First, we should cover what a normal eye does when it comes to tears. So normal eye is very efficient at producing and draining tears. If you look at the nasal corner of the eyelids, there will be a slightly pinkish section, and within there on the top and the bottom lid, these are called nasolacrimal punctae, and they're essentially the opening for the drainage passage for tears. They lead into little passageways called canaliculi, which opens into the lacrimal sac. The lacrimal sac drains into the nasolacrimal duct, which drains into the nasal passageway. That's why your dog and your cat have wet noses. This is also why when humans cry, we get a runny nose. So when we have tear staining, what's happening is that something is interrupting the normal way that tears drain, causing the commonly noted symptoms. We might have dampness or wetness around or most commonly under the eye. People will also often complain about a reddish-brown staining of the fur under or around the eye. This is from porphyrins that are in the tears. Less commonly, I also hear complaints about skin irritation or odor. Sometimes we'll even get skin infections surrounding the eyes. It's crucial to remember that tear staining is a symptom, not a disease in and of itself. So now that we know it's a symptom, let's cover the most common diseases that are associated with tear staining. Your veterinarian may diagnose something called epiphora. That simply means that there's excessive tearing of the eye. This can be due to a number of underlying problems. We might have nasolacrimal duct obstruction, there might be a foreign body in there. Sometimes we'll even see infected tear ducts. If we have something called keratoconjunctivitis sicca or dry eye, then there may not be enough tear production and the eye will actually produce some mucus as it's trying to lubricate the eye, and that mucus can dry around the eye, resulting in this tear staining that people will notice. We might also have conjunctivitis, so this would be an infection, whether it's viral or bacterial. We might also have trauma to the eye. We could have something like glaucoma, which causes eye pain, which can cause epiphora. We can also see abnormal eyelashes like distichia or ectopic cilia. We can also have abnormal eyelids. Sometimes the eyelid will roll out or roll inward, and this can cause irritation to the eye, resulting in epiphora. Second, we need to remember that conformational issues can play a role here as well. Most often I see this problem with brachycephalic breeds or the smushed face dogs. This is because sometimes their eye sockets are not deep enough for their eyeball. This causes a number of problems, but among those can be tear staining because the tears don't make it through the normal tear drainage mechanism and they just spill out onto the face instead. I also will sometimes see when there are too many nasal folds and not enough nose that the fur from the nose can start to irritate the eye because it rubs the eye or is too close to the eye. This causes a lot of pain for the dog. Sometimes the hair from those nasal folds might also simply obstruct the normal tear drainage, and that can cause tear staining as well. Third, and this is a bit less common, but some allergies or sensitivities might contribute to tear staining. Fourth, irritants might be part of the problem. Perfumes, smoke, smog, those sorts of issues with irritants in the air can bother the eyes of your pets, causing tear staining. And lastly, diet can be a contributing factor. I have a number of patients that were eating not research-based diets that didn't end up meeting WSAVA guidelines. When they blended over to an appropriate diet that was research-based and met WSAVA guidelines, they noted that the tear staining was dramatically reduced. I don't have a lot of research on this side of things. This is a bit of an anecdote, so take that for what you will. Because there are so many potential causes and a lot of them are actually very painful for the animal, the most important thing to do is see your veterinarian. You might also need to consult a veterinary ophthalmologist because, like, say for example in the clinic I work at, I don't have the tools necessary to look for eyelashes that are growing abnormally that could be irritating the eye. So to rule that in or out, I need my clients to take their animals and see a veterinary ophthalmologist. However, I can do things like test for how well the tear ducts are draining. And so what we'll do is we'll put a drop of fluorescein stain into the eye, and then we just tip the head a little bit down. And after a couple of minutes, you should see fluorescein stain coming out of the nostrils and resulting in the nose glowing when we look at the fluorescein stain under the fluorescent light. This is lots of fun. If there are ever kids in the exam room, they love this test. If the fluorescein drops are noted to drain out the nose normally, that's great, and we can rule an issue with the nasolacrimal duct out of our potential list. However, if we don't see the fluorescein stain, then further investigation is necessary. And there are patients that I end up using sedation for so that I can use a special probe to check for patency of the nasolacrimal duct or to check for foreign bodies that might be in there. Sometimes we'll also take samples to look for various infections. I can also flush out the ducts, which can help if there's been any buildup or inflammation or irritation in that duct. There are some patients that won't have a properly formed nasolacrimal duct, and that can be from birth. Some of those can also be corrected and opened. Sometimes they can't, but that is something to consider. It's also important, if you note that your dog or cat regularly has issues with tear staining, that you are gently cleaning around the eyes regularly to prevent drying and buildup in that skin irritation. It's crucial not to use hydrogen peroxide products, as those can cause a lot of damage to the eye should you ever get it in contact with the eye itself. Make sure to use a product that your veterinarian approves. Often just a damp, clean, warm cloth or piece of gauze can work. It's also important to feed a research-based diet that meets WSAVA guidelines, and your veterinarian may also recommend adding some probiotics to that. There are some patients that having the probiotics helps them out significantly. Of course, the specific treatment plan for your individual animal will depend on what the underlying cause ends up being. Eyelashes that are bothering the eye will need to be removed. Maybe a nasal fold needs to be surgically removed. Maybe the nasolacrimal ducts need flushing. Maybe we do a hypoallergenic food trial. I mean, there are just a bunch of potential treatment options that will be formulated depending on what your veterinarian finds. However, here's just some general information for you. Keeping the area around the eyes as clean and well maintained as possible is important. You may need to seek a groomer's help to trim longer fur if that might be bothering the eye. Probiotics might be helpful. There are so many remedies that I'll see floating around the internet that all claim to be wonder treatments for this. There's no research on any of them that I could find, and certainly many of my clients report to me a lot of frustration that they don't work, and some of them even end up being dangerous as they're not safe for use around the eye, so just avoid those altogether. There was a period of time where some veterinarians were trying to use a low dose of an antibiotic. This is no longer recommended as it's poor husbandry as far as appropriate antibiotic use. It leads to resistance and causes problems that way. If infection is thought to be part of the problem, we need to appropriately dose the antibiotics for an appropriate length of time. We tend to only use antibiotics if there is a lot of evidence of infection and or if the skin around the eye also appears to be infected. There is some evidence that daily probiotics will help some pets. However, I warn people when they try this that it can take over a month before you see a significant difference. The bottom line is don't use any product without seeing your veterinarian, and that a proper medical workup is required because a lot of the causes for tear staining are painful, uncomfortable for your dog or cat. This medical workup may include seeing a veterinary ophthalmologist, so just be prepared for that recommendation. As far as prognosis goes, if an underlying cause is identified and treated, those patients usually end up doing great. For the patients where we don't end up finding an underlying cause, I kind of have some patients do better than others. Some patients deal with some amount of tear staining for their entire lives. Some of them seem to have like kind of intermittent bouts where their tear staining is better or worse than at other times during the year. If your dog's facial anatomy or tear drainage system is formed in such a way that it prevents normal tear drainage, then those patients end up having some amount of tear staining essentially for their entire lives. However, in those cases, this is more of a cosmetic problem. So remember, each animal is unique, and so working with your veterinarian closely is the key. I hope that you found all this information helpful. Please comment down below if you have a pet that deals with tear staining. Did you go through the appropriate medical workup? If not, make sure to contact your veterinarian. I love interacting with you in the comments, which is why I highlight one every week. I also put up a new video most Fridays, so I look forward to seeing you in the next one. Bye! You're a good dog. Can you napsy, please? Yeah.